Hello, everyone, and welcome to RevitalyzeMD, all things aesthetics and wellness podcast with me, your host, Dr. Debra Durst. And I have the team and my co-host with me today. So I'm going to let them all introduce themselves.
I'm Meredith, and I am one of the skincare specialists and laser techs here.
Hi, I'm Marissa. I'm a medical esthetician and laser technician.
I'm Ellie. I'm a licensed esthetician and laser technician.
And our acne specialist. Don't let her forget that. And I'm Faraday, nurse practitioner here at RevitalyzeMD.
So today we're going to talk about acne, and this is a passion of Ellie's. And again, I think this is a very hard area to treat from a skin perspective, at least from a medical basis. You know, it's never been my forte to be able to give the perfect acne treatment. So we've been working on protocols all along, and, you know, we had some pretty good ones, but Ellie came in with some great ideas as well. And so again, I'm going to learn a lot today because I always have these girls as my go-to when it comes to questions. You know, I'm basically a cleanse and exfoliate and go see Ellie and Marissa. And so today we're going to talk with Ellie and Marissa, and we're going to learn more about acne. So maybe we start even with that, or the different types of acne.
So we usually like to start with categorizing the patient's acne. So like you said, we have hormonal, which is sometimes caused by a lot of teenagers will have hormonal if they're going through a super stressful time, going into college, going into high school. And we've also got comedones, which are just those little whiteheads and blackheads underneath the skin. And then we've also got pustules and papules, which are like the more bigger ones that sit underneath the skin that are sort of sensitive to the touch.
Mm-hmm. That are kind of raised in appearance?
Yes, okay. Raised, and usually have a lot more redness than the others. And that's when people complain about, oh, it hurts. Like, oh, this, like, I can feel it when I touch it, or it hurts when I wash my face, like those kind of things.
Because they get a little inflamed too, don't they?
Yes.
So the whiteheads and like the blackheads, if I was to say it simply, like the comedones, like, are those like pre-pustules and papule stages, or is it a different type of acne?
It could be.
Can be.
Mm-hmm.
So it can progress, or it can just be just a clogged pore.
Right.
Otherwise. Okay.
Hard and sebum plug.
Okay.
Now, I know for me, like right before my cycle, I'll break out around my jawline. Mm-hmm. And that's always been more hormonal. And I've always attributed that to estrogen changes. But I don't know if that's true or not when we talk about hormonal. It just seems to be the ebb and flow of what does occur.
Yeah, I think that absolutely happens when around our cycles, especially, we start getting those hormonal breakouts around our jawline. A lot of women get those, even adult women. So it's not just teenagers, because that's what a lot of people come in and complain about. They're like, I feel like a teenager. I'm having all these like breakouts around my jawline. And it's not just teenagers. It's women going through menopause. It's women going through stressful times in their life. It's women going through pregnancy. It could be a multitude of different things. So
and it seems to me like, again, you know, in the premenstrual, perimenopause, you know, when estrogen's highest is when, you know, that happens. But also, you know, it's sebum and oil that really causes a lot of that. So, you know, testosterone changes as well, because you get a lot of oil production then. And so birth control sometimes seems to help with that a little bit too, unfortunately.
Absolutely,
you know,
yes.
Fortunately and unfortunately, because you don't want to use it just for that. But if you're on that, then it helps with it. So then you're talking about different, you know, treatments. So if somebody comes to you for acne, kind of walk us through what you would do with that patient.
Yeah, so when the patient comes in for their initial consult, that's typically when I try and like categorize their acne and kind of decide what I'm working with and maybe what's causing it. I ask about their lifestyle. Do they do any sports? Are they active? What's their diet like? Are they on any medications? You know, are they on birth control? That's a lot of one that I'll ask women, just because if they've gotten off of it recently or they're just now starting it, that's when we see a lot of purging happen, one way or the other. So I usually start with, like I said, categorizing it, finding out what their lifestyle's like. And then we talk about their home regimen, like their skincare regimen. What are they using at home? What are they willing to do at home? And so... important. Yeah, I basically start with that and just kind of see what we're working with and like where we can start and what they're willing to do for their acne, because it's something you have to be super consistent with. I mean, that's usually like the first thing I tell people. If you're not willing to put in the work at home, if you're not willing to come in monthly, you're not going to get the results you want.
which is true. And so
Yeah.
it seems to me like, even dermatologists don't do a great job at,
The basics.
solutions and
Mhm.
basics
That's
for.
No.
That's a pushing.
They
but-
throw antibiotics or Accutane. I can't tell you how many
I
women
know.
that we see in clinic that had Accutane, and that's a pretty intense medication for
Mhm.
acne if you didn't
Absolutely.
have like really terrible
You've not
acne.
been struggling for a
Exactly.
very long time.
It should
Exactly.
be
There
last
are
resort,
a lot
too.
of other options, but I think it's the easy answer
Yeah.
a lot of times. It's the quick Band-Aid. It's a quick fix. It's
Mhm.
the person, not willing to see if they're even willing to do the work. It's here's a medication and out the door we go.
So, and to me, like as we start to explore it more, and it's more like the traditional approach versus a functional medicine where you're getting at
Yes.
the root cause. And so, what estheticians and you guys do better than I do as a physician is again, know skin and how to care for skin and what maintenance requires. The expectations need to be set, but exploring the root causes to then, develop a treatment regimen. So
Absolutely, because I've written Doxy. You've written Doxy.
Oh, yeah.
We've done it.
Yeah.
It's an easy fix,
Mm-hmm.
but definitely I think that's why we are so lucky here to have Ellie on board now and to have Marissa and Meredith to go over skincare and to help our patients develop that regimen and that routine care to help prevent some of the root cause, where Doxy we can use to clear them, but then to remain clear
Yeah.
is key.
Absolutely. And I think that's when sort of like their home care regimen
Mhm.
steps in to help out a little bit, because sometimes it is needed. The antibiotic is needed. But it's always last resort, for me at least, to come to Dr. Durst or Faraday and ask if that's an option for that patient.
Mhm.
So I think starting with let's do a consistent treatment plan. Let's come in and let's see you monthly or every 2 weeks if that's what it takes to get you cleared up. Let's do that for at least 3 months and kind of see where we're at.
So what does that look like? What kind of skincare are we talking about at home? Are we buying grocery store stuff? Are you recommending professional ones? Are we doing facials? Are we doing extractions? Like, what does that look like when you say home care and in the office monthly or weekly or biweekly?
So I usually, which most people are surprised by, usually when treating acne, I try and keep it pretty simple, just because if we have too much going on, you can't target what product is bothering their skin. Me and Marissa talk about this a lot. You always need to add in one product at a time. And so I normally will start with probably just a cleanser and an active treatment product like a tretinoin or retinol. Or benzoyl peroxide product. I usually will try and add in one active at a time just so we can kind of nail it on the head if something isn't working with their skin.
So one product, just so you know how they're reacting to it, and also probably keeping it simple for them so they actually are
Absolutely.
consistent with it.
You can build that.
Yeah.
Build that routine and commitment to what they're
Yeah.
doing at home.
Yeah, and it seems to me like if it's mild acne, commitment might be an issue. But as they get more severe, they've seen multiple providers and are not getting solutions, then it seems like they're ready to commit to something
Absolutely.
and actually pretty desperate at that point to find solutions. And so then when you're talking about, skincare products you're going to combine, or you're going to start with maybe one, add a couple, keep it simple at first so they can be persistent at home. And then in the office treatments, what are some things that you recommend?
I usually, depending on the severity of their acne, we could always start with a hydrofacial if it's more clogged pores, sebaceous filaments, things like that, where there's just excessive oil in the skin. We could always start with hydrofacial. It's a little bit less aggressive than maybe an acne facial. So if we're looking more of moderate to severe acne, I always say, hey, let's start with an acne facial. And that's where they're going to come in, get a really good deep cleanse on their skin. We'll do extractions and usually end it with a treatment mask.
Okay.
And we kind of consult about products if we've not done an initial consultation before their acne treatment.
Do you guys feel like the hydrofacial extracts enough, or a manual extraction is sometimes necessary?
It's really according to the situation, what we're looking at. But manual extractions do make a big difference.
Okay.
However, you can get clean out more pores at the same time with a hydrofacial.
So start with a
But if they have a
hydrofacial
big
then.
boil, okay, let's Let's
Yeah.
get that.
Yeah,
Let's get that now.
exactly. So starting with a hydrofacial, getting everything clean
Mm-hmm.
and cleansed and sucked out, and you can see the
Literally.
water after that. It's amazing.
Absolutely. And I've done both. I've done just a hydrofacial and I've done a hydrofacial with extractions. And I will say a hydrofacial with extractions afterwards, my skin purged more so than with just the hydrofacial. And I was so clear for like 2-3 months.
Mhm.
And then I added a new product and I'm like, okay, well, maybe that's not one for me, or maybe it's hormonal. And then it's kind of back to the drawing board sometimes. But definitely the extraction with the hydrofacial made a huge difference in my skin afterwards. And that was
Absolutely.
the first time I had combined those two together. So I would definitely recommend that for somebody who has a lot of blackheads, whiteheads, in addition with the hydrofacial, because where manually she was able to get a lot more than to go back with hydrofacial after to get the remaining, that it was very beneficial.
Yeah, sometimes the suction with the hydrofacial is rather too much, or for their skin type, or because they're raw. Their skin is just, purging and mad at everything. But you can really get with the manual extractions really in there.
I think it can also be in certain situations, if those blackheads have been sitting a super long time, sometimes the hydrofacial isn't enough. And that's when we need the manual extractions with it. So I think, like Marissa said, it really depends on the situation and what the patient you're dealing with, what their skin's like. And I feel like you can normally answer that question pretty quickly. Like, do they need a hydrofacial or do they need an acne facial?
So it's interesting because, again, if you get used to doing extractions, you probably are a picker. You probably can't help but look at people and want to pick
Like,
things,
oh,
right?
I gotta get that.
Yeah, I gotta get that. Yeah, no,
Which is
definitely.
terrible.
I know.
Right?
I know.
I'm terrible about it. I need to do better.
Yeah, no, well, and so it sounds like, so what about, so you're bringing them back at least once a month, if not,
At
once
If not
every,
2 weeks,
2
according to what
weeks.
we're working with.
okay.
Absolutely. And I think just
And
being
expect-
super honest with them
Yeah, I was
starting
going to
out
say
at that initial,
expectations.
because I always let them know, I'm like, hey, you're probably going to look worse than you did when you came in when you leave today. And
it's a
you're just going
process.
to, you're going to have to give it a couple days for your skin to calm down. And then you're really going to see how much we got out. And, you're going to start to see those results that you really want to see and see like, hey, there is hope, with clearing this up, because it's hard. It's an emotional thing too. I went through it in high school. It's very emotional. So yeah, I think it's just like being super honest with them and saying, you have to do this or this isn't going to happen. It's like going to the dentist. You have to brush your teeth to like get a good teeth cleaning at the dentist, So,
Yeah. Well, and it sounds like, so 3 months is a pretty realistic, like, you got to stick with something. Stick with us, trust in the process. For 3 months, we should at least know maybe what products are right for you, what treatments in the office, the regimen, and you're going to see improvement for sure. Because a lot of these patients have been to so many different places with so
Jumping
many
around,
different,
listening to too many people.
correct.
And then you don't know if they're just listening to your advice or if they're listening to other people and trying to sneak things in. And then they come back to you and you're like, did you just do these 2 products? And they're like, well, I was doing this over here too. And I was doing this. And then it's like, you got to start over. So it's very important to just, one thing at a time, only follow one person's
Trust the
advice at the time.
process.
Yes, trust the process. And again, that can take, 3 or 4 months sometimes.
And asking more questions, because maybe they're using the most aggressive products, which maybe that's what you recommended, but are they using it morning, noon, and night? That's not a good thing, because you're over drying your skin. If their skin's producing more oil at that point and you're drying it out on top, it's all getting blocked and stuck in the middle.
Yeah.
So
More is not better.
It's worse. So sometimes if I feel like someone is doing that or would do that, we're going to be a little bit less aggressive. So we're not drying them out too much. We can work with that.
I
We just gotta
completely
know.
agree with that. I think like educating them on how to use the product is so important. I think that's what might be like skipped at the dermatologist or when they're going to these different places for skincare advice. they're skipping out on that personal conversation of how to use their products. And like, this is how you're going to get success from your products. So, because if they go home and they start a tretinoin and they're using it every single day, they're going to hate it. And their skin's going to hate it too, which is what the prescription
way too much.
And that's what the dermatologist recommends
all the time.
And then we have resistance.
I can't do retinols. I can't do retinols.
Yep.
I react to them.
Yep.
Everyone reacts.
I'm
to
allergic.
Yeah, everybody reacts.
Everybody reacts.
You're supposed to react.
Yeah.
But as soon as they learn how to use it, they love it. You know, like it's like, okay, this is a game changer. I think just teaching them how to use it and letting them know what's going to happen to their skin when they start it. So,
when I think what's so important with all of this is that, again, who do we go to for acne typically? Where do patients go? Dermatologists.
That's the first place I went.
Correct. And a lot of people do. You know, they don't go to their primary care doctors. They go to dermatologists for that. And a dermatologist is a physician, and they're going to approach things with medications. That is traditional medicine. We're not huge fans of that. But again, I'm a physician, and that's skincare and skin, treatment with product and micromanaging that is not my forte. And so again, estheticians are awesome with skincare and skin and knowledge of skin and what to do, but it's a process.
It's a treatment plan.
You should have a specialist that does know acne better than skin and skin types and, skincare products. And you need to find an office if you're not local here. Again, you can reach out to us still, and definitely like, subscribe, share, and comment on, I'm sure that we'll have lots of comments on acne, problems, solutions, attempted things, but find somebody that specializes, an esthetician in your area that specializes in acne and acne treatments is my best advice for this, because the dermatologists, we get patients all the time, from the dermatologists, and they're awesome at what they do, but I don't think acne is a strong.
No, and a lot of times only carry one line of skincare products, and that one line may not be the best for your skin. I have a skincare line I like better than another skincare line just because of how it reacts with my skin. That does not mean that's going to be how it reacts with Ellie's skin or Marissa or Meredith or Dr. Durst. So I think that is really important to have those options. What about lasers for acne? That's something we haven't really talked about. We've talked about the facials. We've talked about, the hydrofacial and extractions. But what about lasers? Do we have lasers that help with acne?
We do. IPL does amazing with acne because it's going to kill the P acne. We also have the blue P acne. Don't ask me what the P stands for because I will tell you wrong. You may have that answer. We just call it P acne. It's easier. But the blue LED lights, the handheld, that is great for acne, as well as the acne treatments we have with the Photona 1064. So we can spot treat with that or cover the whole face. We usually start with IPL first because we know it's going to kill the P acne immediately. And good skincare and hydrofacial combinations. And then if that's not doing what we need it to do, we usually will revert to Photona.
Okay, and then you were talking about light therapy?
Yes, the blue LED. And that's something you could do at home. We have the light stem blue LEDs that you can use at home over acnetic skin, and it's going to make a huge difference. We can add it to a hydrofacial. It's amazing.
And if you do live remotely, you can always reach out, and we'll put some links in the show notes too, but you can reach out to the office and text the number or call, because we can actually order the Pro blue light through Lightstem and have it shipped to you as well.
Yeah, drop ship.
And that's a handheld that works, and the blue kills bacteria, and that's what the P. acne is again, it's a long P name, not necessarily, but it's a bacteria that is most commonly causing your acne, And so in addition to sebum and oil, then you have bacteria that grows. And so one of the pro tips, is again, IPL for killing, the bacteria while you're getting your treatments.
And another one is Morpheus. Morpheus is RF microneedling. So the RF, when it is pulsed into the dermis, it is going to also kill the P. acne and heat up the skin. And you're going to help with acne scars, active acne, and resurface.
Mm-hmm. And you can use it with active acne. So, and it heats.
People will to kind of purge. A lot of times that people will purge a little bit with that one, which is good. You're getting a hand on what's under the surface that people didn't even if they weren't having active acne or, anything that they really noticed, sometimes they will break out from that just because they were congested and they didn't do hydrofacial. They didn't do other things prior to that.
Congested with a lot of bacteria growing underneath that isn't yet causing a problem, but will.
Never even seen, right.
Yeah. And so again, the heat kills the bacteria, but you can also obliterate some of the sebaceous glands that are forming the oil that are causing the problem and the scarring reduction, because a lot of patients have scarring with acne, especially severe or cystic acne over time. And so it helps significantly with scarring. So
now with the IPL and the Morpheus, those can both be used with acne, active acne.
Yes, absolutely.
Okay.
Absolutely.
How
as
do you
well as the
feel-
photoma. Absolutely.
How do you feel RevitalyzeMD does it like do, I mean, I know scarring over time and, it does a lot of beneficial, but like with active acne, would you ever consider using that or go more towards IPL?
I'm not going to say I wouldn't, but when you say active, I would be more like blackheads, whiteheads, some small little pimples, not like clusters.
Do you feel like they get worse potentially? Like
I wouldn't say worse. I would just say very
irritating.
uncomfortable when it's more superficial, when you really want to
Gotcha.
get deeper into the dermis. Would it help? Probably. I don't think it would make it worse. That may be on an individual basis. But if it's a lot of active clustered breakout, I wouldn't do the RevitalyzeMD.
all right.
Here and there, they're
Because
fine.
you really want to get deeper if you're
wanna get
going to. Okay.
So not your first choice.
Not
Be
my
very
first choice.
spicy.
What about
Okay.
peels?
Chemical peels are great. Salicylic acid peels are the best for acnetic skin. Would you agree, or do you have any
No,
other
absolutely.
options?
Yeah, definitely salicylic acid would be my first pick for a acne prone patient. I've had salicylic peels and they were game changers when I had acne. And so that was kind of my first step into like I dipped my toe in medical aesthetics sort of. So with the chemical peels, that was really cool because I was like, wow, like aesthetics, like versus going to a med spa versus the dermatologist was just, that's when I was kind of like, oh. And that's when I really decided like I want to do aesthetics. So chemical peels were a big deal in my life. So
they have a
What's
place
that?
with acne.
yes,
That
absolutely.
makes sense because it's kind of just loosening up the tissue and getting all that, dead skin cell, but penetrating a little more, right? Cleansing.
Absolutely, get the acid
With the-
panel
yeah.
off, the sebum plugs, let it purge, show it
All
the
right.
exit.
Yeah.
I think too with treating scarring afterwards, that's a really cool thing about RevitalyzeMD. We've got so many things to treat acne scarring. So we've got lasers, we have chemical peels, we've got microneedling. There's so many options. So we're not having to send our patients somewhere else. We can give them the full treatment here.
Start the process
Yeah.
and complete the process.
Yeah, complete the
Mhm.
process and move on to the next skincare concern.
So I feel like the important thing is having specialists within an office that you can send and depend on and link to. So like, again, if I'm seeing perimenopause, menopause that has acne, and I had that recently, and Ellie was free and she met with Ellie that day. And so then Ellie can take over the initial, treatments of the acne and set up a protocol and, bring her into the office, which she was more than willing to do, but I can't do that as well. And then again, if it goes to laser and now we're treating scarring where, Marissa is going to head that up and do the scarring and, laser regimen with it, and Meredith as well. So I think just having those go-to people within the office
Absolutely.
that specialize in it, because you can't know everything about everything, and you can't be the go-to on everything either, because you're never going to have that special niche and knowledge, and it's best if it's focused on something.
Absolutely. And I can't just
So-
say how many times I've been like, Meredith, Marissa, and now I have
yes.
Ellie, where I'm like, hey, you got a quick second? This patient's got XYZ going on. So now we have Ellie as well to grab for our acne patients, which is awesome. And we're quick to do that. So get ready.
We got these two with the lasers and anything you want to know, and again, that esthetician and the knowledge base there with skincare is amazing. So, and then we'll do more the hormonal and
All the other things.
other cycling issues. And so we'll handle that. And then, but it's awesome to feel so supported within a team,
Yes.
that you don't have to. And we're always going, each other aside. Even developing protocols for different things.
Absolutely.
We've done that over time, which has been
constantly. If we're
Mhm.
stuck on something. So yeah, it works
Yeah.
very nicely we work nicely as a team.
It's good to have different perspectives, different backgrounds, different experiences. So we all get to add in uniquely. So it's a pretty cool thing we've got going on here.
I know it is. And that was interesting because, again, off the topic a little bit, but we added Morpheus Body to our treatments recently. And we had a patient and we wanted to do a little debulking and use the Morpheus Body tip. And it was all three of us, actually 4 of us, because Jamie was in too.
Yeah.
Yeah, and we were figuring out exactly how to do it and what we thought we should do. And yeah, and we did, come up with a final plan, but it was a collaboration of 3-4 people and doing that with amazing results. So if you find an office that you trust and find providers you trust and somebody that specializes in whatever you are looking to see improvement in, and that's your best first approach. If you have any questions, please drop them in the comments, like and share, and also share your experiences. The more that you listen, the more you share with others to listen. We appreciate it, but it also lets us get the word out there and makes all of this more popular. Again, thank you everyone for being here. And if you have anything else you want us to talk about, let us know, because we're here to revitalize your look, your health, and your sex life.
Thank you.